Well, it's been a while since we talked about the current number of COVID cases, but as winter approaches and as we all spend more time indoors together, the chances of the virus spreading increase, and so does the pressure on the health service. So we asked our science correspondent, David Gregory-Kumar, to delve back into the data and assess what coronavirus might hold for us all this winter. And he joins me now. So, David, what's the current situation?
It's actually quite hard to tell these days, Mary, and that's because we're doing a tiny fraction of the testing we once did. So the testing data isn't really a useful guide anymore. So let's look at actual daily deaths from COVID in the West Midlands. This is daily deaths with COVID mentioned on the death certificate. This is from the very start of the pandemic, so massive peaks here back in sort of April 2020 and then sort of January 2021, peaking around 150 deaths a day. Well, we're now living right over there at the end of this graph, and compared to all this, living down there is clearly nowhere near as bad. Thank the vaccines and improved hospital care for all that. So if we zoom in and look at the last 3 months of data, we can see deaths and indeed hospitalisations have been steadily climbing and then peak and start to come down again. And this time they only peaked at around 8 deaths a day in the region. But as we head into winter, that's likely to go back up again. So is COVID now a winter bug?
It's a little early to tell whether we're going to be seeing seasonal patterns. Of course, in winter, we do see respiratory viruses more generally start to peak. And that, of course, is what COVID's doing. Whether we settle into what we've had with influenza of October, November, December time, it's starting to peak and then decaying away as we get into the spring. A little bit early to tell, I think.
So let's compare the number of deaths to the number of hospitalisations. And these two graphs tell a real story about the success of vaccination and of treatments for COVID. Now, at the start, these graphs mirror each other. So the number of deaths on top there, as infection goes up, you see the number of hospital admissions increase and the number of deaths goes up as well. And it's the reverse when infection starts to drop until about summer 2021, round about there. And at that point, despite plenty of people in hospital on the bottom there, the number of deaths is much lower. That line at the top is much, much shallower. So just how deadly is coronavirus today?
If we look at the data, I mean, it's still more serious than influenza. It's certainly less serious than it was a couple of years ago when we hadn't got the high levels of vaccination that we've got now. But it's really, really important, of course, that the elderly and the vulnerable keep taking those booster jabs so that we can minimise the risk to the more vulnerable members of society.
But remember, all these people in this bottom graph, well, they are taking up hospital beds. They're hospital patients. So this whole graph represents extra pressure from COVID on the NHS. So COVID hasn't gone away. And for older people, people with existing health issues, it remains a serious threat. Since the pandemic started, in the West Midlands, going by what was written on death certificates, 23,000 people have now died from the virus. And that number is still increasing. Mary.
Okay. David, thank you.